Maybe some of you have had loved ones who have committed suicide. Maybe you've had patients. Maybe you have had people close to you. Maybe you've struggled with suicidal thoughts yourself. Suicidal thoughts are more common than I would like to put out there. And suicide is the 10th leading cause of death. For people younger than 30, substance use disorder and antisocial personality disorder is more common. For people older than 30, it's more common to have a mood disorder, depression, bipolar, schizophrenia. About 2/3 of suicides are done by men, and 5% of suicide completers have some physical illness. 90% of suicide completers have some major psychiatric disorder, and about 1/2 of them were clinically depressed. If a patient has schizophrenia, up to 50% will attempt suicide, and 10% will commit suicide. In a big Veterans Association study, they found that the suicide rate was quite a bit higher than the general population, especially those who use substances. It was 75.6 per 100,000 people compared to 34.7 per 100,000 of all veterans. So if you have a veteran that uses substances, it's about double. And compare that to the general population, which is 11 per 100,000 people. And so our vets really do struggle. War does something to people long term. Now, women who have been in war, in this study, if they used substances, the hazard ratio, the ratio of the risk that they would commit suicide was quite a bit higher than men actually. Opiates, for example, the hazard ratio was 1.19, whereas for men it's 2.37. So it's quite a bit of a bigger risk if women use opiates, alcohol, amphetamines, cocaine, cannabis. Marijuana increases the risk 1.35 in men and 3.89 in women in this one study. Finally, in this podcast episode, we discuss physicians. Now, physicians were more likely to commit suicide later in life, but actually quite a bit less likely to commit suicide than the general population in residency. So physicians start out in training with a lower suicide rate, and then as they get older, they have a higher suicide rate than the general population.